Allison.
Good morning, Doctor.
Roland Matthews, how are you today?
I'm doing well.
So, Ms. Richardson, you know that,
Oh, call me Kimberly.
okay, Kimberly, you know that we have been taking care of you for quite some time, and you had the ovarian cancer, and you had your operation, and we had chemotherapy after that, and you have done well. But now we have a recurrence of that tumor, and we're here to decide how we'll move forward
Right.
with treatment. I know you also got some information in the mail about a clinical trial, but first I would like to talk to you about your treatment for your recurrent ovarian cancer.
Okay.
And what I'd like you to think about is to participate in a clinical trial. We discussed your case at our tumor board,
Okay.
and the multidisciplinary team identified a clinical trial that they think would suit your situation. And what that trial involves is there are two arms to the trial.
Okay.
Since you were responsive to the chemotherapy before, we can give you, one of the arm is the standard chemotherapy, which is what you got previously that worked. And the other arm is the standard chemotherapy plus another medication that's a PARP inhibitor. And we don't know how well we need to compare the arms to see if when we add the PARP inhibitor, if patients would do better with that PARP inhibitor. And so it's a randomization. We don't know which arm you will be on. That is done at the main office where they randomize if you decide to participate in the trial. So, and also as part of the total cancer care protocol, we will also take a buccal swab to, we take some tissue from the mouth, just a swab, to, just like the letter that we sent you home said, and gets sent off for genetic testing and so forth. Do you think you might be interested in any of these trials?
Well, certainly, I think I'd be interested because of the recurrence, I want to know about any new advances and any new treatments that could perhaps prolong my life. But I did want to kind of start with the first trial where you said something about swabbing.
Sure.
Because I saw the video.
Yes.
And I have to be honest, I do have a few concerns about how the information is collected, who gets an opportunity to view it. I guess in the back of my mind, I'm thinking about like Henrietta Lacks and how they took all those samples from her, and they, when I think about it, they even diagnosed her incorrectly. And so I'm a little concerned about, because she had cancer too, and I'm a little concerned about that whole taking of my bio specimens, as you all called it, tissues and stuff, and trying to really understand how many eyes, how many hands are actually on my data.
That is a good question. I think that, as you know, before we do any trials of this type, there's an IRB process where both the sponsoring agency, which is the NCI, or have to they make sure that it's being reviewed appropriately.
Now, what's the NCI?
The National Cancer Institute,
Okay.
or any other agency that sponsors these trials. Make sure that there's an IRB process that we have here at Morehouse School of Medicine, and also at the hospital that we are conducting the trials from. They review it, and we also have, as part of the IRB, We also have patient advocates and community advocates on that board to make sure that it is set up appropriately, so only people who need to see the data is seen, and it's stored in a secured place, and more importantly, is de-identified so that your information is removed so that your personal information is not there for the most part. So the information will be used to allow scientists to study your type of tumor and see what type of treatment would work best when we aggregate all the patients with your type of tumor on it. So I think it's a very good protocol to help us, especially the minority population who have been left behind in some of these studies, to participate in the studies to make sure that the treatments are actually geared towards them as well. So that's the reason.
Well, I have a few more questions, if you don't mind.
Sure.
What is IRB?
That's the Institutional Review Board. That is where we have both scientists, ethicists, community leaders who sit down and make sure that each clinical trial is safe and appropriate for the community that it's in. And so they make sure that your rights are preserved, and it's required for all clinical trials.
So is that informed consent letter I got in the mail?
That is correct. They also review the informed consent. We have to make sure that you understand what the trial is about, and that you understand that it's a voluntary participation. You can, if you decide to participate and you want to stop at any time, that is perfectly okay. I have to make sure that you have all the information that you need and all your questions are answered. You can see in the consent that there is a portion that tells you all the risk and benefits of the trial. And also, there's someone to contact if there's any problems or any concerns at all. So there's strict monitoring of what happens during the clinical trial to make sure that you're protected in every way. So, before Henrietta Lacks, there wasn't any rules or laws. Now there are very strict rules and laws to protect patients on clinical trials.
That's good to know. Is my doctor involved in this clinical trial, or am I going to two separate places to be in the treatment? And what if I get sick while I'm on the treatment? Do I go back to my doctor, or do I see someone that's associated with the trial?
Well, for the total cancer care, I think that it's just given the specimen that, so I don't think there will be those issues there. For the treatment trial that we're also talking about, that will be done at the hospital, and as your physician who took care of you before, I'm one of the investigators on that trial. So I will continue to participate in your care and deliver that protocol based on the protocol that we are using for this treatment. So I will make sure that everything that you need for that protocol is done specifically to what we're supposed to do for that particular trial.
I see. Well, I guess the only other kind of questions that I might have are the things that might go wrong. You said there's a person that I can always call or talk to throughout the trial. But what if, I just want to withdraw?
That is perfectly okay. You have the right to withdraw from the clinical trial at any time.
Well, can I take my data with me?
I knew you were going to ask me very difficult questions.
patient would end up receiving a medical report of actionable biomarkers that have been discovered that will be able to, the physician can help you understand and make sense of. In fact, some of that could help family members, your daughters, your nieces that may have, in the case of ovarian cancer, for example, a BRCA1/2 mutation. If it's found that you have that, then it may be important for family members to be checked as well.
So you said something about biomarkers. All these terms are getting a little confusing. Biomarkers, is that like the same like as heart rate or?
Well,
What is a biomarker?
it's part of your genetic blueprint of what makes you you. And we're all different. There are some genetic markers that tell us what diseases one may be susceptible to, what cancers one may have the risk of getting.
Thank you.
So I think though it is well protected. You'll get some information, as our PI said, that might be helpful to you and your family. But your information is always your information, and that information will not be shared with anyone outside of the trial that does not have permission to see your data.
Well, I do think it's important to be involved both in the genetic part of the trial, because I do want to know whether or not my daughters or even my sisters, we all may have some sort of mutation. So that's important because, well, I didn't have any symptoms that were associated with my ovarian cancer. So I think it's important, and particularly because there's no screening test for ovarian cancer, I think it's really important that we do this kind of work. So I guess I think I'd be more inclined to participate.
Do you understand that in participating, there's no guarantee as to, at least for the treatment trial, as to which arm you'll be placed on? That is done randomly. In other words, once you decide to participate on the trial, someone at a central location will almost with a coin flip, by chance, you'll go on one of those arms. You do understand that?
Oh yeah, I feel like with my cancer, it felt like I was unlucky, so maybe I'll be lucky in getting the right part of the trial.
And you do understand also that the first arm is the standard therapy, where whether or not you were in the clinical trial or not, you would get that therapy. The second arm is the standard therapy plus the additional drug. And you do understand that we will continue to treat you with standard therapy if you were to choose not to be a part of the clinical trial.
Well, I sort of understood that. It wouldn't make much sense to be in a trial, particularly with my recurrence, if I wasn't getting some basic standard of care, because then I could just go to my own oncologist. I wouldn't have to participate. But yeah, I think the additional therapy, if I was able to get it, would be extremely beneficial, particularly in learning why I had the recurrence in the first place.
Right. So I think that's great. I think that we will get you started as soon as possible, and you will be monitored. We will have you meet with the coordinator, and so that you can see the schedule, because we follow patients on our clinical trial even more closely than we do if you're not on the trial. So we have a coordinator who's going to work very closely with you to make sure that you are, you know when you have to get your test done and any follow-up care that you need, which will probably be a little bit more than it would be if you were not on the trial.
Well, it's good to know that you all are doing this in particular for African Americans. I think that, you know, with our numbers as it relates to ovarian cancer, that it's important that we get this data.
That is very good. So I'm going to give you your, the protocol again, as well as the consent form. I think it's, even though we've sat here this morning and I've explained it to you, I think it's very important that you take the consent form home and the protocol and read it again at home and discuss it with your family. And I'm going to make an appointment for you to come back in another week or so, and we'll sign that consent if you still want to continue on with the trial. I think it would be a good thing to do for all the reasons that we discussed, and I really appreciate your willingness to participate.
Well, I have a high expectation. So thank you for the offer.
Thank you very much.